So we are live. Hi guys, my name is, we're not live yet. Oh, now you are. Hi guys, my name is Ashley. I'm a physical therapist here at Physical Therapy and Balance Center in Rockville, and welcome to another one of our Facebook Live videos. So today we are going to be talking all about balance, which is a topic that I'm super passionate about and is definitely very prevalent for a lot of you guys. So we're kind of going to talk about the process that needs to happen within our bodies in order to maintain our balance, and then we'll talk about some of the things that can go wrong that can cause our balance to decline. So first, let's talk a little bit about what needs to happen within the body to keep our balance. So there are three things that need to happen here. So the first thing is that we need to be able to collect information about our environment using our senses. The second thing that needs to happen is that information needs to be sent up to the brain where it's processed and interpreted. And the third thing that needs to happen is that the brain needs to send signals back down to our muscles so that we can make the appropriate postural adjustments and keep our balance. So today we are going to be focusing on the first part of that process, that sensory collection piece. So there are three main systems, sensory systems, that we use to collect information about our environment. So those systems are the visual system, so our eyesight, the somatosensory system, or our sense of touch, and the vestibular system, or the inner ear. So let's start with the visual system, because that's a system that we're obviously all very familiar with, and most people seem to have a pretty good idea of what goes on. So as I go about my day, my eyes are constantly collecting information about my surroundings. So I can see what's in front of me, I can use my peripheral vision to see what's off to the sides, what's above, what's below me. And then there are receptors in my eyes called rods and cones, and they're able to perceive that information, and then it gets sent up to the brain where it's processed and interpreted. So there is a simple balance test that we like to do when patients come into the clinic, and I'm going to see if I can grab our special guest David to help us demonstrate today. Let's see if you can grab it. So he's making his way over.
I have my name tag on or off?
Oh, you're fine. Whatever you prefer. All right, so come on over here. So what we're gonna do first, we're just gonna ask David, so you can kind of come off to the side here. We're just gonna ask him to stand with his feet together and with his eyes open. So go ahead and stand with your feet together. His eyes are open right now. So that's pretty easy, right?
Yeah.
And that's something that's pretty easy for most of our patients. There are not a lot of people that really have difficulty with this. So what I'm going to do next is ask David to close his eyes. So go ahead and close your eyes, keep your feet together. So how does that feel?
A little bit different.
Okay, yeah, a little bit different. So it looks pretty good. And David he's young, he's healthy, he's active, his balance is really good. You can go ahead and open your eyes. Thanks, and we'll call you back in a couple of seconds.
All right, thank you.
So what did I do by asking David to close his eyes? Essentially, by having him close his eyes, what we did was eliminate one of the sensory systems that he uses normally to collect information about his environment. So what we did was decrease the quantity of sensory information that our brain is receiving. So that is something, that can definitely be problematic when the eyes are closed, but it's something that is also prevalent when we're in a dark environment. So if maybe you're walking outside at night, maybe you are getting up in the middle of the night to use the bathroom, you're diminishing that sense of vision, and you're decreasing that quantity and that quality of sensory information that your brain is receiving. And the same thing goes for people that have visual impairments. So if you have cataracts, if you have macular degeneration, glaucoma, anything where your vision is impaired, that's going to have an effect on your balance as well. So that in a nutshell is the visual system. That one's pretty easy to understand. So let's move on to the somatosensory system. So that might sound like kind of a big word, but basically what it is our sense of touch. So I'll kind of give you a little bit of a visual here. I'm just going to stand up, just tilt it down towards my feet. Yeah. So as I stand here, what my feet are doing, There's sensory receptors in my feet. They are giving me great information about the surface that I'm standing on. So those sensory receptors in my feet are able to take that information and send it up to my brain where it's processed. And the brain then says, okay, we are standing on concrete versus we're standing on grass, we're standing on dirt, we're on an incline, a decline. And then the brain can send signals back down to my muscles, and I can kind of make the appropriate postural adjustments so that I'm able to keep my balance when I'm standing on different surfaces. So let's bring David back over for a second. All right. So in a person with normal sensation, our body kind of has, well, everyone's body kind of has a little bit of a natural sway. So even if we stand here completely still, even if we think we're completely still, we're still moving a little bit kind of from side to side. And in a person with normal sensation, so David has pretty normal sensation in his feet. He doesn't have any issues there. When he sways to the left a little bit, his feet can pick up on that. And they send that information up to the brain who says, okay, we moved a little bit to the left. Now we need to move a little bit back to the right and make that correction. And the brain sends that signal back down and he moves to the right a little bit. And this is a super, super quick process. It happens totally subconsciously. We are not thinking about it. And it's really effective in helping us keep our balance. But where we can run into trouble is when we have abnormal sensation. So there's a condition called peripheral neuropathy, and basically what that means is that sensation is diminished in the distal parts of the body, so in the hands and in the feet. This is really, really common in people that have diabetes. It's common in people that have certain vitamin deficiencies. It's common in people just as we get older, and for some people, it happens for reasons that we don't understand at all. So when a person with abnormal sensation sways a little bit to the left, their feet are not picking up on that. They have no idea that they moved to the left. So the brain can't say move back to the right because it doesn't know that they moved to the left. So that's where you can end up with a loss of balance from side to side, especially when the other senses are challenged, especially when you're in the dark, if you have your eyes closed, if you're on an uneven surface. So that's where we kind of run into some issues there. But now what I'm going to do, so David has pretty normal sensation. Let's put a piece of foam underneath his feet. So go ahead and take a step up onto the foam there. And we'll go ahead and we'll challenge you a little bit more. You can put your feet all the way together too. So what did we do here? We obviously didn't eliminate the somatosensory system because his sensation is intact. But what we did was alter the quality of the sensory information that we are receiving. So we altered that surface. So David's brain, so his feet are picking up on what's going on, what kind of surface he's standing on. And then they're sending that information up to his brain who says, we're on foam, so we need to use those ankle muscles to work a little bit harder. So you can't see it quite so much, but there's definitely a little bit more muscle activity going on at his ankles because he's challenged with that different surface. So you can go ahead and take a step off. I'm gonna need you in a couple minutes again, so thank you. So that's the somatosensory system. So our third system is the vestibular system, and we're just going to talk briefly about this one. This is a system that I'm super passionate about. I love treating patients with vestibular disorders, but it's a really complex system and I could talk for hours on it, so we'll try to keep it pretty brief. So I think there are a lot of misconceptions about the vestibular system, especially in terms of where it's located. So here's my outer ear, the outside here, the part you can see. And then my ear canal is also part of that outer ear. Then we get into the middle ear. So that's where you have your eardrum, and then you have the little bones in there that help you hear. So then the inner ear is actually inside of my skull. And I think that's a really big misconception that people have. So if I go to the doctor's office and he looks in my ear with the scope, he cannot see my inner ear. The only way that that can be visualized is with some kind of imaging, whether it be a CT or an MRI. So that's definitely good to know a little bit about the anatomy of it. So let's talk about what exactly the vestibular system is. So you probably heard that word before, and basically it refers to the inner ear. And there are two parts to the inner ear. There's the part that helps us hear, that's called the cochlea, and then there's the part that helps us keep our balance. So basically that balance organ is made up of a few different structures, including some semicircular canals. There's fluid in those canals. There's also hair cells in those canals. And we also have in some of the little structures, little calcium deposits, which some people know as crystals. And all of these structures work together to let us know when our head is moving. So my vestibular system can tell me when my head is moving, how fast it's moving, which direction it's moving in respect to gravity. So it basically tells me where I am in space. And that's something that's really, really important for us to keep our balance. So fortunately, most people have a pretty intact vestibular system, but where we can run into trouble with this system is when people have a condition or disorder that causes them to lose function in the inner ear on one side, or on both sides. That's not quite as common, but typically we see it on one side. And when that happens, their quality and quantity of sensory information that they're receiving from that system is totally altered. And these people typically present as dizzy. Their balance is typically pretty bad. So that's the vestibular system in a nutshell. We won't go too far in depth as far as that goes. But what I'm going to do now is I'll bring David back over if we can. Looks like he ran away actually. But what we're going to do is kind of give you a little bit of a better idea of how these systems interact with one another. So let's see if we can grab him. And he's on his way over. He's running, so all right. So ready to go. All right. So we're going to take you through some of the same things that we just did, but we're going to talk about it in the context of the systems interacting with one another. So go ahead and if you could tilt the camera down a little bit. All right, so first we'll ask you to stand with your feet together, eyes open, just like we did before. His balance looks pretty good here. So right now, David has full access to all three of those sensory systems. He is using his vision. He has an intact somatosensory system. He's standing on a hard floor. And then he also has an intact vestibular system. So all three of those senses are intact. Okay. So now go ahead and close your eyes, David. Okay, so we talked about this one before. So what we did here was we eliminated that source of visual input and we forced him to rely more heavily on that somatosensory system and on that vestibular system. So now go ahead and open your eyes again. Let's add the foam so you can take a step onto that. Okay, good, and eyes open for this one. So here we're challenging the somatosensory system, but we still have intact vision, we still have an intact vestibular system. So we are testing kind of his somatosensory system here. And now I'm going to ask you to go ahead and close your eyes. And this is where we definitely can run into some challenges in terms of balance. So what we've done here, we've eliminated his vision, we've challenged his somatosensory system, and we are forcing him to rely very heavily on that vestibular system. So as you can see here, maybe you can't see quite so well over the video, but I can see it pretty well. David is swaying quite a bit forward and backwards, a little bit from side to side. I can see if I look down at his ankles, those muscles are working really hard for him to keep his balance. And that's in a person that is active, strong, flexible, young, healthy, has completely intact, you can go ahead and open your eyes, completely intact or sensory systems. So that's definitely a challenge because we took 2 out of those 3 sources of sensory input and we altered them. So we forced him to rely on 1 of those 3 senses. So that's good. You can actually, you can take a step off and I think we're good. So thanks for your help. So I think it's pretty easy to see for the most part how diminishing one sense, or if you have, an impairment in one sense, how that can really affect your balance overall. And we see this all the time in the clinic. So now you're probably sitting there thinking, well, crap, I've had peripheral neuropathy for 30 years. Am I just destined to have crappy balance? Or maybe, I have cataracts and I haven't been treated for them. Is that, going to affect my balance? So, okay, if you've had a peripheral neuropathy for 50 years, are you going to regain sensation in your feet? Probably not. And if you have a visual condition that you haven't been treated for, is that going to be a consideration for you moving forward? Yeah, definitely. But the good news is we can train the balance system even when we have one or more of these sensory impairments. There's a principle called neuroplasticity. And what that basically means is that the brain is able to form new neural connections, and the brain can change and adapt. And this is really good news because as we train our balance system in certain ways, we can learn new movement patterns and new strategies to keep our balance. So this is a really great thing. And when patients come into the clinic, this is, this whole thing that we talked about here, this is what we look at. And we try to identify, is there a sensory impairment? Are they relying more heavily on one sensory system versus another? And what are the deficits in terms of balance? And then we go ahead and we challenge those deficits and we pick on them and we force the brain and the body to learn new strategies, to learn new movement patterns, and to adapt and to maybe become less reliant on one sensory system versus another. So that's pretty much it for today. If you guys have any questions at all, feel free to post them in the comments and we'll do our best to kind of get back to you. But otherwise, have a great day.